Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Going to be speaking with Dr. Shereene Idriss this morning. She's joining us to talk about a brand new campaign, Face Up To Rosacea, that she's launched in partnership with Galderma and celebrity stylist, TV personality, and rosacea sufferer Brad Goreski. Welcome to the program, Dr. Idriss.
Neil, thank you so much for having me. I'm so excited to be here.
A bit about your background. What's your area of expertise? And talk about this partnership with Galderma.
So I myself am a board-certified dermatologist. So skin is my passion in life. And I deal with patients who have skin disorders ranging from acne, rosacea, psoriasis, and also cosmetics as well. And I partnered with Galderma and Brad because Brad himself had suffered through rosacea his whole life, and I myself had had my own problems with rosacea as well. And so we found Galderma approached us, and we thought it would be the best partnership to kind of raise awareness, spread the word, allow people to realize that it's not so uncommon and it shouldn't have the stigma that it has, and to help people really help themselves, not just physically, but also emotionally. Because rosacea, although it is a physical condition, can definitely have a much deeper psychological impact on patients.
Now, this awareness campaign is called Face Up To Rosacea. Above and beyond what you just told us, what do you hope to achieve with this campaign long term?
Long term, we hope that people realize that it really is not so uncommon. And we hope to recognize the fact that rosacea, although a chronic disorder that doesn't really have a cure, has many different treatments available that can help suppress the symptoms. And hopefully people can seek out that help that they need, not only to help their skin, but also to help themselves emotionally, because a lot of patients who suffer from rosacea are actually also borderlining with emotional depression because they're so anxious to be seen, or they don't want to go out, or they're scared of the flare-ups that might happen when the rosacea flares up. And so for us, through this campaign, we're hoping to make it much more mainstream, much more accessible to the masses who are suffering from rosacea, and for people to really empower themselves to learn more about it and to learn what they can do about it.
So what are some of the usual signs and symptoms of rosacea?
Classic signs being classic. So rosacea is basically means rosy redness. So whenever you think of rosacea, you think of somebody who has more of a red kind of underlying skin tone, people who can kind of flare up or flush very easily when they're nervous, stressed, anxious, or eating spicy foods. In addition, acne-like breakouts can also appear with rosacea. So that's why it's oftentimes misdiagnosed or confused for acne. People also over time can develop enlarged blood vessels on their face that can stay more chronically over time and get worse in appearance, and sensitive skin, just underlying skin sensitivities as well. So those are the common classic signs of rosacea that you would probably usually associate with the classic condition.
You talked about some of these flare-ups being misdiagnosed. What are some of the, non-classic or atypical rosacea symptoms that doctors or sufferers should look for?
I think the most common atypical or unclassic rather, or under-recognized is the ocular rosacea variant, where people have symptoms with their eyes, or they have irritations in their eyes, or they often feel like there's some sandpaper-like sensation to their eyes. And that can actually be associated with rosacea. So if you're somebody who tends to flush very easily, who gets those, blemishes, or who has those dilated blood vessels on your face, or that you would kind of naturally classically associate with rosacea, but also have eye symptoms where your eyes feel itchy, irritated, a little bit inflamed even, then I would tell you, make sure that you don't have, rosacea, because the eyes are actually, I think, the most under-recognized symptom associated with the skin disorder.
You talked about some of the psychological aspects, the psychological burdens of this disease. Not to downplay the fear of simply going out or being seen, but some of these psychological aspects are very serious. We're talking depression, things of that nature that might prevent a person from seeking the care that they actually desperately need.
Absolutely. Absolutely. I mean, I think it's 55% of people with severe rosacea say that they would rather trade in a year of their life in order to find a cure. So that is pretty significant. And so people who have rosacea, it's oftentimes kind of dismissed as just a very physical, benign, superficial issue, but it can really have much deeper repercussions. And so if people can learn to help themselves throughout the process. And I think that can have a drastic impact on their psychological well-being.
Talk about the biggest challenge that you hear from patients dealing with rosacea.
I think the biggest challenge when it comes to rosacea is an unawareness of what's going on and not knowing how to find the resources to help themselves. So through this campaign that we've partnered with Galderma, we've created this website, faceuptorosacea.us, where patients now, through their fingertips, can download a dermatologist discussion guide that not only has tips and tricks for people to help their skin, but also for them to help themselves emotionally throughout the process. So I think that's probably the best advice I can, share with everybody today, is really to sign on, to learn more about the disorder and to empower themselves throughout the whole process.
And where can our listeners learn more online about Face Up to Rosacea, the campaign?
So faceuptorosacea.us, not .com, .us, and you'll find all the information there with a discussion guide that you're easily accessible and very easily downloadable.
Dr. Idriss, I appreciate you joining us here on Health Professional Radio this morning.
Neil, thank you so much for having me. You have a great day.
You do the same. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.